A very good morning or a good evening. Take my greetings with respect to whichever time zone you're watching this video on. Hi, I'm Yash and I'm from India, and today I would like to talk about glioblastoma and particularly my project on drug discovery in glioblastoma. So as some of you may know that glioblastoma is a fairly common brain cancer with very high mortality rate and affecting patients usually above the age of 50. The symptoms are fairly common to other brain cancers, but its highlights include crossing the corpus callosum and high mitotic activity with tumor growing twice the size in one day seen in some of the patients. I would also like to highlight the fact that FDA has only approved one drug that goes by the name of temozolomide. And even though we have come so far in terms of clinical research and basic neuroscience research, the median survival rate for GBM patients is still 12 to 14 months, which further motivated me to find novel therapy for GBM. In this project, I have used one phytochemical from one of the very well-known medicinal plant that is local in India and that goes by the name of Giloy. And I've screened them against two of the target proteins, which are VEGFR and NF-kappa B's upregulator, that is protein kinase C beta type. So one of the main reason for which I took VEGFR is because VEGF is very much upregulated because of GBM's high growth and up inhibiting VEGFR2 would be a very good option because it will limit the tumor growth, making it prone to surgical resection. Also, I use NF-kappa B's upregulator protein kinase C beta because NF-kappa B has a high role in transcription of anti-apoptotic proteins such as BCL2 and etc. So the further steps are fairly common, retrieving and visualizing the structures of PKCB and VEGFR2 and preparing and minimizing the structures of proteins by UCSF chimera and predicting the active site using MTI open screen. So for the results, first I would like to show you the structure of VEGFR and PKCB chain A, and I further did the active site prediction, which I further revalidated using the previous literature. Now I did the Lipinski filter analysis of berberine, where the molecular weight was very low, hydrogen bond donor was 0, hydrogen bond acceptor was only 4, and log P was 3.10. And it also followed the Lipinski rule 5, makes it safe to administer as an oral agent. For the docking results, I would like to show you the figure 5 where the berberine has been bound to VEGFR, and in figure 6 berberine has been bound to VEGFR with active site highlighted, and it gives free energy of minus 8.4, which is fairly good. In figure 6, I would like to show you berberine bound to PKCB, and in figure 7, I would like to show you the berberine bound to PKCB with its active site highlighted. And the gives free energy is of minus 7.9, which is also fairly good. Now I would like to show you the 2D visualization which I have done using the software Plot, and you can see the active site residues, which are the hydrophobic contacts, which are many with the ligand, and this is the 2D plot between VGFR and berberine. Now I would like to show you the 2D plot between PKC, beta and berberine, which also shows many hydrophobic contacts between them. I've also predicted the ADMET properties for berberine, which shows that a very high probability for crossing blood-brain barrier, which makes it a good drug to administer for brain cancer particularly. It also has, also is non-carcinogenic, I'm sorry, and uh, I would also like to mention few more facts, which include that it is also an inhibitor of renal organic cation transporter, and it's also an inhibitor of cytochrome P450 TD 2D6. Further, I would like to discuss that even though the GBM is a hot topic with 1430 papers published in till May in 2020 alone, we have still not come to a very good prognosis. I would like to speak about that we can use this medicinal plant that goes by that's Giloy and use its other phytochemicals against these proteins and test its efficacy. We can also use other phytochemicals and test against other proteins and see their efficacy too. Other methods can also include using conjugates of berberine and using berberine as a pharmacophore model. Further, I would like to point that we can also see the RMS data, that is, we can also do the molecular simulation studies for the complex of berberine and VEGFR and PKCB and see how the data is. And if the data is good, we can also take this complex and we can also take this drug, to in vitro and in vivo studies. With this, I would like to conclude my project and thank you very much for listening. Have a good rest of your day.